Hey GP learners, in this session we've got Dustin from Primary Care IT talking about their new tool from OneContact called OneContact Triage, and it's basically designed to try and make your life easier with online consultations, and we're going to see if it can actually do that for you. In addition, you can switch bits of it on and off, which sounds really cool to me, and maybe we've got some other stuff coming for you as well. It's your opportunity to see the product and ask questions, so let's tech enhance your primary care and learning. Hey GP learners, so as I said, I've got Dustin here from Primary Care IT. How are we doing there, Dustin?
Hey Gandalf, I'm doing well, thanks. Thanks for having us on today.
No problems. So I know you've got some really exciting stuff that you guys have been working on to try and help basically practices deal with, online consultations, which has been, to be fair, a bit of a struggle for the past few months for many practices and things. So talk us through what you've got and let's hear about it. Yeah.
Brilliant, thanks Gandalf. So I think people will already be familiar with OneContact because we've been using that over the last since the beginning of COVID, really, to provide online remote reviews for practices to be able to contact their patients. And OneContact Triage is basically the next logical extension of that, to really bring a holistic kind of way of practices approaching online and communicating with their patients. So it's really exciting. We're on the digital first online and consultation and video consultation framework. So that means that it's a nationally funded framework that we've managed to get onto and collaborated with a couple of really exciting partners. So between us at Primary Care IT and IATRO and Exxon, we've got a fully functioning platform that embeds video, soft phone telephony, outreach and inreach and all sorts of different types of contact. So for those of you who don't know us, so I'm Dustin, I'm founder of Primary Care IT, and we do embedded tools to streamline practice systems, so EMIS Web and others, and we're basically into anything that makes GPs' lives easier using tech. We partner with IATRO. IATRO offer practice websites with Practice 365 and Practice Intranet as well, and they provide the tech platform that OneContact sits on. And then we've also worked with Exxon, who do telephony, and they've provided a video consultation platform embedded within OneContact, and that also can operate as a soft phone. So effectively, you can phone, you can text, you can video call from within the platform. You've got a website included within the platform, and then all of those options are configurable to you as a practice, so that you can get what you need for your patients. So we're really excited at this collaboration because we think bringing three companies together who've all got kind of really skills that complement each other, we can do something fairly special that I think any one of us on our own would probably struggle with. So that's us. So we've got outbound ways of communicating and inbound ways of communicating that practices can utilize. So the outbound contact is the existing OneContact platform. You can identify patients that you need to review for things like asthma, for things like diabetes, for hypertension, and then you can send out those patients a web link, which will take them to a form. The patient then completes that review remotely, and then that data can be reviewed back at the practice and filed back into the patient record. We've got some fairly clever smarts embedded within that now as well. So you can upload a file, which is a search from EMIS or from System 1, and that will automatically then fire off the appropriate request to the appropriate patients. And we've also got really smart views of the responses that come back from patients, which show you which elements of care are needed for particular patients, and where there are issues that need picking up during the review. So that's the outbound kind of methods of communicating with patients. And then you've got the inbound methods of communication. So that might be a video consultation that you want to do with a patient, and you can just pop the patient a text link and then dive onto a video consult with them. Or it may be that you want to use one of our e-consultation forms. There are loads of different ways. We've built the system in a modular way, so we've built it in a way that practices can turn on or turn off various different elements of the system. We'll show you a bit more about that later on. But so you might want to turn on the day requests, you might want to turn on routine requests for appointments, you might want to turn on meds management requests or medicines queries, you might want to turn on admin requests or sick note requests or those kind of things, and you can do all of that on the website, because it's a product that includes a website. It gives you that functionality to be able to turn on and turn off all of those different modular elements. So this is what the remote reviews look like. So you would identify your patients and send out the links. The text goes to the patient. They click on the link, and then this on the right hand side here is the patient's view that they would get for an asthma review. And you can see it's all in really nice accessible format, and you've got accessibility options down the bottom here. If you've got problems with completing these kind of things, then you can use those and then bring it back, and the data can be filed back into the GP system, streamlining your system. This is the OneContact platform itself. You've got the form library, you've got all the responses that are coming back in, and then you've got ways of managing OneContact, including setting up your teams, setting up which team members are part of which groups, and then you can flow all of the different forms to different groups within the platform. And again, all of that is practice specific, and you can choose how much or how little of that to use. If you want all of your responses to come back as emails to a specific email address, you can set that up for each individual form to go to different email addresses. If you want to manage it entirely within our platform, you can do that as well. It's how you're best to set it up within your own practice, and this gives you a modular way of being able to do that. So these are the types of forms that you can send out. So you can see we've got really wide-ranging types of forms that can go out. They're not just clinical disease reviews. They might be consent for children for flu. It might be about updating carer information or diet and activity information. We've got all sorts of calculators, so things like Audit C or an IPSS or PHQ-9 or CAD-7 score or CAT scores, ACT scores. They can all be sent out to patients as well. You've got your disease reviews, including things like pill checks and HRT checks, and all of those kind of things as well. So they're quite useful. This is the view that you get when you're sending out the form, so you can preview the form. The really smart bit about this is what's covered within there is expandable, so you can click on that and see exactly what elements are covered during the review. You can also see what clinical evidence we've reviewed to feed into the development of that particular form, and then you can send out the form either using gov.uk Notify, or you can copy and paste the link into your existing messaging platform like AccuRx, iPlato, or MJOG. Or if you've got Exon telephony, then you can send it out using Exon text messaging. So this is the form that you then complete to send to the patient. You drop in their mobile phone number, or you can upload a file. And if you upload the file, you can then tick which reviews you want to send to which patients, and then submit that through to the system, and that will then automatically send those patients who have those conditions the appropriate reviews. So that, I mean, in my practice alone, that saved hours of admin time in terms of having a person having to manually figure out which patients are due recall, then contact them, and then if they've got 2 or 3 different diseases, then they're going to get 2 or 3 different text messages. This takes care of all of that seamlessly. So it really does help. That's the remote link that the patient gets and completes. And then these are the results that you get in terms of clinical importance. So you can see all of the information that you need to do something about was at the top there. So if we scroll through to the next, I'll just go back to that one again so you can see that a bit more easily. So you can see this one is being highlighted that the inhaler technique's not good and that they only take their inhalers when it's bad, and that's all pulled out at the top and highlighted in red. And then you've got all of the rest of the data of review that comes back there, and you can see we've just scrolled through to the next patient as a demo, and you can see they've controlled their asthma control was suboptimal, and so that's all been pulled out. So inbound contact, so we've got various different ways. As you said, the whole of the practice websites are built in a modular way. So all of these different modules within the practice website, you can turn on or turn off and have visible at various different points on the day. So you can promote your online services to your patients. So if you've got medicines ordering online, you can pop that on. If you want to use the e-consult forms that we've created for a variety of different conditions, then you can go ahead with that. And then it pulls back into the clinical system. So this is an example of where you've gone whole hog and you said, yep, we want just online consultations for anything. So we want appointment, admin query, contact a GP, submit your request online. So you just hit one button and then that will take the patient off in the different direction that they need to be taken off in order to be able to complete that. You may not want to do that. You may just want to have a module on your website that is just a medication request, in which case you can do that. Or you might want one that's just an admin request, so a query about a report, a referral, or one for your admin time. So for referrals, we've got a specific one. So it asks if the patient has been referred. If they have been referred, have they heard anything from the hospital? If they've already seen the specialist, have they had investigations ordered? And then it flags that if they've had investigations ordered, those will go back to the hospital and they need to contact the hospital for those. So it's really quite detailed in terms of the information that it gives back to patients, and hopefully helps to signpost them to the appropriate place for their query. So that's quite useful. And then this is the kind of back end that the user can actually flag which elements they want to turn on and when they want to turn them off. So you can choose which days you want to show things, you can choose what time you want to show things, and you can edit this on the fly. So if you get to the stage where 11 o'clock, all your appointments are gone and you're completely snowed and you think we're going to have to take everything by phone and it's going to have to be really heavily scrutinized by a senior clinician at the point that happens, then you can just turn this off, go into the back end of the website, turn it off immediately, and then you will default to having all of your contacts via telephone in your practice. So it's really configurable. So these are different packages that we've got. You've got a basic package and a pro package. In the basic package, this is really aimed at single practices or PCNs, and has got all of the tools embedded within it. You won't be surprised to learn our pro package in classic primary care IT style is really around localization and kind of doing specific work to try and help your local region. So at the moment we're working in Northeast London and trying to help with some of the long COVID referral work and building bespoke forms that may be able to help with that. And we're also doing some similar work in Northwest London as well. And all of that is about taking local pathways, understanding what those are and which providers are involved, and then figuring out about how we can take local guidance and local information and resources for patients, embed all of that stuff into the platform, and then have something meaningful that goes out to patients that hopefully helps them to navigate their journey towards being seen. So this is just talking about the work that I just mentioned. So this is our long COVID form, and you can see we've got loads of links in there embedded within the platform. Some of those are national, some of them are for the local hospitals. So Homerton's come up with some really useful resources. And again, if the patient says that they're suffering from breathlessness or fatigue, then those specific resources are then shown to that particular patient, which can be really helpful. So that is a really quick overview, Gandhi, of the platform and kind of what it does. I don't know if you've got any queries or questions. I'm conscious we ran through that quite quickly, but
no, it's no problem. So happy to take any questions from our audience in terms of what they may be curious on. I do have a couple for you, so while
sure.
those to come in. You mentioned obviously about this kind of modular approach that you can switch it on, switch it off, that kind of stuff. I mean,
yeah,
that sounds quite cool, particularly from a practice perspective. I can imagine if you've got days where, for example, you've got more prescribing support and other days where you've got less prescribing support, you can obviously then filter that to have it used on the days where you've got more support in preparation for that work kind of thing, to make sure that works a bit more effectively and control the hours and stuff. So I really like that prospect. But I guess my question with that would be, how easy is that? And I know you kind of gave us a brief demo on it a bit, but, you know, say, for example, tomorrow my prescribing clerk calls in sick. I've got nobody to do that. Can I literally just go in the back end and switch it off?
Exactly right. Yeah. So because you're using the platform for your website anyway, and you've got the training and support for getting up and running for using the platform for your website, then your team members will be really familiar with how to add a new news article on, or how to add in a new kind of bit of information about a new doctor that's starting in the practice or something like that. And these modules are exactly the same. So you would literally just log into your practice website. You'd be able to see the modules that were on. You'd be able to turn off the ones that you want to turn off on that particular day because there's been something that's been unforeseen, and it would be something that you could do dead easily. So, and we've got guides and kind of how-to videos and all those kind of supporting bits of information to help people with doing that.
Mm-hmm. Cool.
But as part of the onboarding process, we have a series of kind of training videos and engagement kind of activities that help people to to get up to speed with how to use the website functionality. And if you're comfortable and happy with using the website functionality, then you'll be really comfortable and happy with how you can turn on or turn off those different elements of what you're doing with things. With any tech, there's always an element of change management and always an element of it isn't just the tech, right? You've got to make sure that all of your teams know about this, and that your receptionists know that, like, for example, we're just about to push over to having all of our sick note requests being done online, because we think that will save a significant amount of phone traffic, and it's a useful and easy one that we can just push all that work to online. But we've got to engage with our reception team, make sure they know about it. We've got to make sure we communicate with our patients and make sure that they know about it. So there is a process and a kind of change process to doing these kind of things, and you've got to, as part of kind of doing this kind of change of managing your practice, you've got to accept the fact that there are going to be some teething problems, and there are going to be some things that your teams are going to have to change in the way that they work, because that's how everything in general practice works. That's by and large why we wanted to make it so modular, because we recognize through the other work that we do that you go to 5 different practices and they'll approach exactly the same problem in 5 different ways, and each of the practices will think that their way is the right way, because for their population and for their clinicians it is. And so you've got to give people that flexibility so that they can figure out what they want to do that fits with their working practices, their population, their skill mix, and their clinicians.
Cool. So you kind of half answered my next question then. You mentioned about the resources, about trying to help practice teams and patients in particular use these kind of modules. What kind of resources specifically are we talking about, and how easy are they to use, access, that kind of stuff?
Yeah, so there's initial training when you're getting up and going. We've got support forums on our website, and also the usual forums on our Facebook group as well. And we've got, as I say, there's the training that you get when we're setting you up and getting going with it, but then there's ongoing kind of drop-in training sessions that you can access. And we've got a full support team, so you can submit support tickets through to us, and one of our guys will get back onto the contact with you and pick up what's going on in the same way as you would do with your practice website. If you've got a problem with your practice website, you're going to be dropping us a line to say, can you sort this out, or can you add that on, or how do I do this, or how do I do that? So if you turned up and you didn't know how to use the website, and then everybody else in the practice was sick, you pick up the phone to our support teams. They'd walk you through how to log onto the system and exactly what you needed to turn off, the bits that you needed to turn off, and that would get you sorted out for where you needed to get to.
Cool. Okay. I guess a question that comes up with inevitably with any kind of products and that kind of stuff, how much does it cost?
Yeah, so you'll remember from the OneContact stuff before, we've tried to keep this a really low cost acquisition. So OneContact was initially free, and the triage element of it is through the digital first and online consultation video consultation framework is fully funded. So actually, from a practice point of view, it wouldn't cost you anything, because there is national funding that's available for this, and so the NHS picks up the bill for that.
Cool. So if a practice wanted to switch over from using potentially their current provider, okay, so for example, if your practice is using eConsult or online Engage Consult or Accurix or whatever, and they wanted to switch over to using this, how does that process work then?
You would probably need to speak to your CCG or whoever's commissioned your existing service, and understand from them what the process for swapping over would be. And I think each region's probably going to approach that slightly differently. So we've had some regions that have devolved those decisions for the default framework down to PCN level, so that PCNs can actually pick which product they'd rather use. And other regions, they've gone out to a wider procurement and said, no, we're going to do this across the whole ICS region. So I think it's probably worth having a word with your local commissioners about how this is going to be, how the default framework is going to be implemented in your region, and then having those local conversations and dropping us a line if you want us to have a chat with anybody locally.
Okay, so that kind of leads into my next one. If there was an area where the CCG was saying, we're going with this provider, that's our route, we're not changing what we're doing, but the practice feels actually this could be where we want to go. What can they do from that point? And if they wanted to finance it themselves, even, I guess, is that an option?
Yeah, it is. So we've got an option for individual practices to self-fund it, and we've tried to keep that very low cost. So I think that's just £300 per practice per year. However, the video consultation element of it, because that involves text messaging and because it involves the video platform, there are fixed costs with that, which are quite a lot more expensive. So we'd look at that on an individual level, and if they said, look, we don't need video consultations, then we could provide it for the £300. If it was that they wanted the video consultations, we'd need to look at what that looked like in terms of cost for ourselves.
Sure. Okay. We've not had any other questions come through from the chat yet, so
Okay.
I'll still give people time to come through with those. But I know that whilst we were talking before we started this, there was a couple of things that you mentioned to me that sounded really interesting, and I was keen to hear about. I know some of those we're going to be talking about at our System 1 Facebook Users Group conference, which is at the end of this month. So if you aren't signed up to that, definitely join, because there's some awesome things for that, and I'll put the links for that in the description. But there were two in particular I wanted to ask you about. So one is the lovely prospect of GDPR.
Yes.
Whatever it is, yeah.
Yeah.
And the other one, I believe, was something to help practices understand their finances a little bit better as well, wasn't it?
Yeah, absolutely. So the GDPR, or you can never get the letters right in that one, can you? But that we're just finalising the work on a OneContact form for that, which will allow practices to be able to send out really useful information with loads of kind of resources, and hopefully your video Gandhi to be able to drop into there, so that their patients can understand fully what this means for them, and then make an informed decision about what they want to do. And then, as much as is possible, we're going to try and make sure that we can integrate that back into your system in the most efficient way, so that hopefully it doesn't cause tons and tons of admin time and issues for practices. So that's kind of work in progress, and we'll be updating you a bit more about that as we get that ready for rolling out. We were relieved yesterday to see that it's been pushed back to September, because that does give us a little bit more time to make sure that we've got a worked up solution that is really useful for patients, and also it gives the patients a bit more time to actually fully digest the information and make sure they've made an informed decision.
And
so I think that's important.
And as you mentioned, that video about explaining the whole thing for patients is due out tomorrow, which is Thursday the 10th of June. So if you are watching this before, it'll come out tomorrow. If you're watching afterwards, it's already there. So feel free to have a look at that. It's hopefully a decent explainer for patients about the whole situation and things. You also mentioned about another product as well, the income side of things for practices.
Yeah, so this is an exciting bit of work we've been working on for probably upwards of 6 to 8 months now. So this is going to be available on our website on Friday, and is free to use for anybody that wants to use it. So essentially, we've taken all of the national income data for general practice, and then spent hours poring over it and figuring out how we can break it up so that it would be really useful for you to look at as a practice. So we're doing a live webinar launch on Friday, and there'll be details about that on all of our social media channels, email lists, and everything else later on today. But essentially, you've got different areas of your income that you can have a look at. So you can look at your total income, you can look at your CCG payments, your enhanced services, your QOF, other and global income. You can compare your income with up to 4 other practices, which you can pick from either your own PCN, your own CCG, or even nationally. You can look at a summary of all of your QOF areas, and in terms of how you're performing on them, what your prevalence is like on them, and how much exception reporting you've previously been doing. And then you can also look at the impact of prevalence and where your prevalence sits compared to, again, regional, PCN, national, and look at what that might look like. So I've got a few screenshots that we can look through. So this is the main screen that shows you your overall income. So yeah, exactly. You can imagine how much work's gone into this, Candy. It's been pretty huge. So you can look at the data via registered or weighted patient, and you can think, so how do I want to look at this? And then you can do a comparison analysis for the current year with either your own practice previous year, your PCN, your CCG, the region of your practice, or nationally. It will give you how you're doing. So my total, this is my practice, so everybody can see what my income looks like, not anybody else's. And you can look at any practice within the UK with this data because it's all publicly available data. So you can see what my total comparable income is like, and compared with my PCN, because that's what I've selected up here. If I was to select this, it would show me what my income was like compared with my CCG. I can see what's going on with my patients, how many have increased or decreased, and what my average payment per patient is. And then I've got all of the different income lines that are then analysed further in the data sheet here. And I can see what my current income for this year is in each of those. And then I can see what my income for previous year was on each of those. And then there's some analysis about each of those different areas and the differences between me and the regional average or the previous year, and then work our way through that. So that gives you a kind of headline for kind of your overall income, and then you can dive into a bit more detail. So this is looking at CCG income, and you can see for each of these you've got the same options for selection on the left hand side, and then across the top you can see if you're in green, then that means you're getting more than the comparator that you've selected on the left. If it's in red, then you're getting less. And then you can see for each of those underneath you've got a comparison bar chart for each of the different comparisons there. So that's quite useful. This is looking at enhanced service income. So again, exactly the same way of selecting the details on the left-hand side, exactly the same bar charts across the top, and then the detail for each of those is shown below. And then this is looking at your QOF income. So again, you can look at and your global sum income and your MPIG income. And again, you can look at that for current year, previous year, what your PCN average is like, what your CCG average is like, what your regional or national average is like, and then see where any discrepancies may lie. This is where you can compare with other practices. So I've picked 3 other practices in my PCN to look at how we're performing against. And then there's bar charts to show you how you're performing against those practices in each of those different areas. This is your QOF areas. So you're looking at all of the different QOF areas and thinking, here's my achievements, here's my exception reporting, here's my prevalence. And again, compared with PCN, CCG, SDP, region, or national. So I can see exactly how I'm doing with that. And then the final bit, which we're especially proud of, is all of the work on prevalence. So this is looking at how our practice prevalence is performing. You've got all of these different groups, so cardiovascular, fertility, high dependency, other long-term conditions, lifestyle, and you can select each of those. When you select, you can see across this top chart where my prevalence is looking as though it's fairly low. So I can then select that particular one, and I can see actually my prevalence is low in that particular group because I've got a little bit lower prevalence of atrial fibrillation, quite a lot lower cardiovascular disease, and quite a lot lower heart failure, and quite a lot lower stroke. And then what I can do is select each one of those on this bottom chart here, and it will tell me how many patients on my selection is versus the CCG. You can see if I was to get up to the CCG average, I'd need to find 30.47, whatever 47.47 of a patient it is, to get me up to average, and then that would translate into an increased income of £317.81. So for each of those, you can then go through and work out what you want to do. And if you've got our tool sets within your clinical systems, then you'll know that we've got a whole series of searches that you can then go into and try and find those particular patients, and do that work to look at how your prevalence is kind of going. So this helps to inform that, and helps to give you the kind of detailed information that allows you to target the areas that you might have some data quality issues in.
And I guess it can particularly help practices to, like you say, target the areas where there's a difference between particularly their locality and stuff, but also, in terms of hopefully improving patient care as well, to
exactly
where the gaps are and why there's a gap.
Yeah, exactly. And sometimes that's just as simple as coding errors and just data quality that just needs tidying up. And sometimes it's because of the demographics of the practice, and sometimes it's actually there's a bit of work there to do, and actually you need to go away and look at some of the patients who may have had previous high blood pressure readings and haven't been coded as being hypertensive and probably should have been, or those patients who've had irregular pulse coded but then haven't had a follow-up ECG and haven't been added to the AF register. I mean, as you know, with anything in practice, you can go into as many kind of blind alleys as you want, looking at infinite amounts of detail. What we're trying to do here is kind of give you an overview so that you can look at where you in your practice you might want to shine that spotlight and spend a little bit more time doing a bit more work on, to make sure that you're not missing out on any patients that you should be looking after, where you should be doing things.
Okay, cool. So we've had a couple more questions come through. So one was from Ian. So he was asking about the earlier stuff.
Yes.
So how automated is the filing back or the coding to the clinical system from the patient responses?
So it depends on which element of the system you're using. So if you're using kind of on the day consultations for say like earache or back pain or something like that, we don't tend to drop coded information back into the record for that, because what we view an online consultation the same as a normal consultation. So when a patient comes to see me, I'll have a conversation with them about what's going on with them, and then I'll contemporaneously record in the record what I think is relevant and what the important positives, important negatives are, and that will make up my consultation. And I think dropping in an electronic communication into a record is coded data saying that all of that is just fact without being checked is really risky, because we should be viewing online consultations as exactly the same thing. They're a communication, but actually it's up to me as a clinician to interpret what the important bits are and what the important positives and negatives are. So from that point of view, not a lot of data from the kind of emergency stuff is dropped into the records. We've got a way that you can review the stuff that's come in, you can comment against it, and then that can be pulled into the records. But really, we think you're probably better off just recording that as a contemporaneous note based on a communication that you've had with a patient. If it's for stuff like a remote review where there are really definite things that you've collected data points about, so smoking status, or if people have done home blood pressure monitorings, or they've done a CAT score or something like that, yes, that's coded data, and that will be pulled across into the clinical system as coded data, and that can be embedded within the record. So, and those particular forms, at the moment, we've just got QOF data that we'll be pulling back across and into the clinical record, but we've got extended data sets that will be pulling much more holistic information about the patient back into the record, but you'll be able to pick and choose which of those you want to drop back into the system.
And in terms of putting that data into the patient records, if that's EMIS or System 1, is it click of a button? Is it automatic? Is it copy paste? Is it something else?
It should be click of a button and then drop into the clinical system. So that's literally in final stages of deployment at the moment.
Cool. Okay. So I think that's all the questions we've got come through from the chat. I'll give everyone a chance to put some last ones in whilst we wrap up. And as we do so, I guess one thing I really wanted to mention to everybody again is if you want to see some of the newer stuff that Dustin and his team have got planned, definitely join us for the System 1 conference. That's on the 30th of June. And I know that they've got some really cool System 1 based stuff planned for that. I'm anxiously looking forward to that. As well as feel free to check out some of their other content they've done with us in EGP Learning, talking about, like they mentioned, OneContact and a few of the other products that they've got. I know I've been creating some videos for you guys as well to help with some of your asthma stuff. So that will hopefully be out in the next week or two as well. So that hopefully should be useful in helping patients manage, the asthma diagnoses and cough and all that kind of thing as well for many of you. Thank you for your time, Dustin. I know it's been great. I love seeing the stuff that you guys get up to and things, and absolutely can see some of the value this is going to have for practice and stuff in terms of the way that they work and the workflows in particular, and just that modular approach just sounds really, really nice. Just being able to switch on bits and having the control. It's always nice, isn't it, in some ways?
That's the bit that we felt as a practice we really wanted and didn't have. And so that's why we set out on this journey.
Yeah, absolutely. Obviously, if anyone does want to check out that stuff, feel free to do so. I'll put all the links and descriptions down below, and that'll come out shortly. Give me an hour or two, and it should be there. And as always, EGP learners, we're here to help tech enhance your primary care and learning. And we'll catch you in the next episode. See you later.